Good morning, my name is Golnush Rahimi. I'm a practical nursing student at Senecal College. Today I will perform a head and neck assessment to evaluate your overall health and symptoms. This assessment will include observation, palpation, and some basic tests to understand your condition better. It should take approximately 10 minutes, and if you felt uncomfortable at any time, please let me know. I'm gonna perform the hand hygiene with alcohol gel. I'm gonna wear my gloves and wipe the stethoscope with alcohol. Okay, before we begin, can you please confirm your full name and date of birth?
My name is Salah Payman, 5 September 1980.
Perfect. For your comfort, would you like to use the washroom before we proceed?
No, I'm okay. Thank you.
Okay, great. Now I'm gonna ask you some health history questions to better understand your symptoms. When did the rash start?
Yesterday.
Okay. Have you noticed any changes in size, color, or spreading?
No, nothing.
Okay. Have you used any new skincare product, detergent, or
No.
soap that might trigger your reaction?
No, nothing.
Okay. And on a scale 1 to 10, how severe is your fatigue?
It's 4.
Okay. Does it get better with rest or worse with activity?
Getting better with rest.
Okay. Can you describe your headache? Is it dull, sharp, or throbbing?
My headache is dull.
Okay. Where exactly do you feel it? Do you feel the pain?
On my scalp.
Okay. Do you have any non-allergy, including seasonal or food or like occasional allergy?
No allergy. No, nothing.
Have you had any recent flu, cold, or any symptoms before this started?
No, I didn't notice.
Have you experienced any fever, chills, or body aches, or sweating at nights before this?
A little bit sweating.
Okay. Does anything make your sore throat or earache or nasal congestion better or worse?
No, nothing.
Okay. Okay. Have you taken any medication, like over-the-counter drug or any home remedies for your symptoms?
No, just like hot water.
Okay. And have these symptoms affected your daily activities, sleep, school?
Yes, day activity.
For sure,
Yeah.
I understand. Now I'm gonna do the general survey. I'm gonna observe the patient overall condition in order to document the findings. The patient is an 18 years old female. She has a fair skin tone and she doesn't have any unusual odor. She maintained eye contact with me, and she appeared fatigued with a slightly droopy eyelids. The speech is clear, she's well dressed, and she has a good personal hygiene. Patient has average height, she is well nourished, and the body is symmetrical, and there is no visible deformities. The posture is upright, the body build is proportional. I'm gonna check her mobility. Can you please walk to that side for me and come back? By this walk, I'm gonna check the gait, and as you can see, the gait is a steady balance, and there is no visible weakness or dizziness when she's walking. Thank you so much. Perfect. Now I'm gonna check your breathing. Actually, I wanna see if there is any sign of distress. She has a normal breathing pattern, and there is no visible shortness of breath. Or do you feel any chest pain?
No, nothing.
She's a mild nasal congestion. That's it. The patient is alert, oriented to place, time, and person. I'm gonna assess your head, scalp, and facial structure. So I start with the scalp and I do inspection and palpation. The scalp has a normal size and shape. There is no deformities. I don't see any lumps. Do you feel any pain when I'm palpating?
No, nothing.
Okay, so there is no tenderness or pain. I can see clean scalp with no lesions. The hair is dark brown and is evenly distributed. It has a smooth texture and there is no foreign body in it or any abnormalities. She has a symmetrical facial structure. I don't see any masses and any involuntary movement. There is mild swelling around the eyes. I don't see any visible scar on her face. There is no lesions. I don't see any pigmentation issues except the rash on the face and neck. Now I'm gonna check the cranial nerve number 7, the facial nerve. I can test the motor function. Can you please smile? Can you please frown? Now show your teeth. Raise your eyebrows. Now shut your eyes tightly. Can you puff out your cheeks? Perfect. So the movements are symmetrical and there is no facial drooping. Now I'm gonna assess the eyes. Lashes are evenly distributed. Eyes are symmetrical. There is no sign of ophthalmos. There is no ptosis on the eyelid. The eyebrows are symmetrical. I'm gonna check inside the eyes. The sclera is white. There is a mild redness on conjunctiva. The eyes are a little bit watery. There is no visible discharge or crusting. Also, there is no visible blood vessel or abnormalities. Now I'm gonna check the cranial nerve number 3, oculomotor, and I'm gonna check perla and extraocular movements. The pupils are actually 3 millimeters bilaterally, and they are equal, they are round. I'm gonna check the reaction to the light. So they are reactive to the light. And also I'm gonna check the accommodation. Please check the wall at the back. Look at the wall at the back. Now look at the object here. Perfect. So they are reactive to light and accommodation. Now I'm gonna check the cardinal gaze test, and I'm gonna full range of motion in all 6 directions. So please just look at my hand without moving your neck. I'm gonna check the cranial nerve number 3, 4, and 6. Perfect. Perfect. Now I'm gonna examine your ears. She has a normal ear shape. The alignment is normal. The skin color consists with the rest of the face. There is no visible discharge or excessive syndrome. I'm gonna palpate your auricle and tragus. Do you feel any pain?
No.
Okay, so it's non-tender. I don't see any swelling or pain. Now I'm gonna check it with otoscope. Let's do that. So the external auditory canal is pink. There is no foreign body in it or any discharge. The tympanic membrane is pearly gray and it looks intact, and there is no perforations or bulging. Okay, and the lips look pink. It's symmetrical, no fissure, no lesions on it. Can you please open your mouth? The gums look pink and no swelling, no bleeding. The teeth are present, they are well aligned. I don't see any caries, or the tonsils are actually great. It's grade 1 and there is no white patches on them. The hard and soft palate, I'm gonna check them. The color is pinkish, there is no lesions on it, and they are intact. The nose is midline, and I can see mild nasal discharge. There is no septal deviation. I'm gonna palpate the sinuses, the frontal and maxillary. Do you feel any pain?
No, nothing.
So there is no tenderness over maxillary and frontal. Okay, and perfect. Now I'm gonna check the cranial nerve 1 olfactory. Can you please hold each nostrils and blow in it and in and out? The other one? So both of them are clear, right?
Yeah, I can.
Perfect. So please close your eyes. I'm gonna identify at least identify the smell. Okay.
Alcohol?
Perfect. Yes. So this is conclude your test for today. So I'm gonna report the finding to the healthcare provider. Thank you so much for your time. Thank you.
Thank you.
Have a good one.